Hello there, and we are glad to present our breast cancer health service by Elizabeth Romero, Alejandro Barrera, and Matthew Pastor. What is breast cancer? It is a cancer that forms in the cell of the breast and it is commonly developed in the woman. However, every year, more men are developing the illness. Approximately 40,290 women and 440 men will die this year from breast cancer in the US, and the number is growing. England healthcare system. We are inspired by the England healthcare system, and it is one of the best and most equitable healthcare systems of the worldwide. England provides free healthcare to everyone. Most of services are free, except some dental and eyes healthcare service. We want to enable free breast cancer care for all afflicted by it. Who will be running out our health service? Before England is in control of our healthcare service in all the countries worldwide, each country will relocate funding to expand how much is going into the healthcare system. Our breast cancer service will be run by the England government, and since it will be run by England, its government will be the one that is in control of the tax money that is going into the healthcare system in other countries.
The problem that we're trying to solve, as a group, we're trying to decrease the death rates within our healthcare services compared to others who are trying to solve this issue. Our main goal is to provide people with services to detect and attempt to defeat the breast cancer. Low-income communities will especially be attracted to the method of free service for breast cancer. If people also see that we are successful, more people will join our service. The average breast cancer treatment cost for competitors. For patients with no health insurance, it costs about $15,000 to $500,000. Chemotherapy can cost from $10,000 to $100,000 per treatment. Total cost can average out from $100,000 to $300,000. Patients with health care insurance pay about 10 to 50% of total price range. The difference between mammogram pricing, our healthcare service is at no cost. Other healthcare services are averaging at about $100.
Our plan is to lower the death rates within our healthcare services. So by doing that, we're going to make healthcare free for all people. We want to provide free mammogram and breast cancer checking services. We want to provide free chemotherapy and other free breast cancer preventing services. If we provide a free healthcare service that focuses on breast cancer patients, more will go in for regular checkups and more will come to help defeat their illness. What we want to do is to be able to start this across the world in order to help save all people and to stop this disease through research and through procedures of omitting the disease from existence. We want to monitor patients' health by giving continuous examinations and successful treatments or while they're in treatments, we want to ensure longevity. So we will be monitoring their health for long periods of time. This will ensure our services as being persistent in caring about patients' health. We will keep the number of people in each trial 1,000. We will focus on our healthcare service and monitor another healthcare service. We are only focused on the death rates between the two healthcare services. The control group will be the people that are not offered in our healthcare service. Our experiment will focus on the United Kingdom, and if our trial is successful, we will apply it to the rest of the world. These are the death rates in each of our trials.
Okay, so the male and female, we're doing male and female within our experiment because most people don't know that males are able to get cancer, so it's not just female.
Many countries would be opposed to our healthcare system because they wouldn't want their taxes to go towards the healthcare. Our system is run by the taxes by the people and private donors. So if the government doesn't want the taxes to go towards our healthcare system, then there could be issues. Especially those countries ruled by dictatorships are looking to gain a bigger profit through taxes. some people wouldn't feel confident. And another issue could be that some people wouldn't feel confident enough to offend a free clinic because the wrong assumption that free clinics are worse than pay-for clinics. But in actuality, through our experiments shows that our clinic is superior to the other clinics. Our services would change the world. Death caused by breast cancer would effectively decrease with our healthcare system. We would attempt to pinpoint breast cancer before it spreads to the rest of the body and before it spreads to other people. We would give our information to other clinics so that way our methods could reform the world, especially for those who have had propensity to develop breast cancer. Our services will help change the spreading of breast cancer across the body. This way we can help the human race. Besides possible errors, our healthcare system can change the world towards a successful future. The future of the human race depends on the research of breast cancer, because if breast cancer is solved, then we can solve other forms of it and stop it from spreading to more critical areas of the body. Our services would change the view of our world and breast cancer entirely.
Okay, this concludes our presentation.